Okay, it's 12:30. Hi everyone. I just want to say thank you for taking the time to join today's intake forms webinar with Halaxy. It's great to see everyone here, and thanks for your answers in the chat. It's good to see that engagement. My name is Shane. I handle all things marketing here at Halaxy, and I'm joined by our learning and education specialist Ria, who will be leading today's session up, as well as Sarisha, Mike, and Ruchi from our customer service team. They'll be here to answer any questions you have over the next hour. Like I said, it's really fantastic to see everyone here today. A little bit of trivia, though, to start things off. Did you know that intake forms is actually the most searched term in our help guide? It's also been one of our most requested webinars to date, so we thought we would take the time to finally get around to it. Over the next hour, we're going to take a deeper look into how you can benefit from using Halaxy intake forms in your own practice, from setup to fully automating intake forms. But before we get started with today's webinar, I just want to ask you all a few questions to get to know everyone a little bit better. So how long has everyone been using Halaxy for? Are you a beginner in the last month or so? Have you been using Halaxy for a bit longer? If you just want to put those questions in the chat, beginner, 3 years, about 4 years, beginner. So there's a good mix of beginner and people who have been using Halaxy for a longer time that maybe want to learn a few more things, and those who are really kind of getting started. And I guess that follows on to my next question. What do you want to get out of today's webinar? What do you want to learn? Beginner, only using calendar functions, beginner. Yeah, no, that makes a lot of sense. So like I said, we're really going to go through that basic setup all the way to automation. And thank you for those responses. To give everyone a bit of background on Halaxy though, our practice management software was built to handle and overcome the complexity of healthcare, from scheduling, processing claims and payments, to collecting and managing your patient's information, and a whole lot more. We realize that healthcare is complex, and this is on top of the clinical work that you have to do every single day. This is why our goal at Halaxy is to make healthcare more efficient, more effective, and accessible for everyone. But where does Halaxy fit into that equation? See, Halaxy doesn't just reduce your administration, it automates and removes it, saving you up to an hour a day, every day, so that you can focus on what matters most. And here at Halaxy, that's patient care. And intake forms play a vital role in that. Halaxy intake forms make it easy for you to request and record personal information and health information from patients before they even arrive at their appointment. When a patient submits their completed intake forms, their patient profile in your Halaxy account is automatically updated with all that information. This removes administration, reduces human error, and allows you to spend more time focusing on patient care. But okay, that's enough from me. I'm going to hand it over to our learning specialist, Ria, who's going to run through all things intake forms. Thank you, Ria.
Thank you, Shane. Hi, everyone. My name is Ria, and I'm the learning specialist here at Halaxy. I just want to thank everybody for making it today. We know that it was supposed to be scheduled for last week, but unfortunately, I got very ill, so we had to reschedule. So we're here. I'm really excited to be here, and I'm really psyched to talk about the webinar focus today, which is everything about patient intake forms, which includes setting them up, sending them, and from what everybody's looking for, we're going to be automating them as well. So like Shane mentioned, intake forms are our most searched topic and one of our most popular and valuable features that we have. So for this session, I understand that some of you are complete beginners and some of you are, have been using Halaxy for years. So we have had our onboarding webinars. So we trust most of you here are familiar with the basics of Halaxy as we delve into this topic. We have our onboarding series available online. We have our recorded sessions. So if you didn't attend those previous webinars, Shane is just dropping a link to our webinars page on the website. Okay, so before we get started, I'm just gonna go over our learning goals for today. So the first thing I'll show you is how Halaxy patient intake forms actually work. So I'm gonna demo what an actual patient intake form looks like for your patients, what features you can use and how they benefit you. And then we're gonna get into the exciting bit, which is how to set up a patient intake form. You can decide what sections and what questions to include, so your form is customized to your needs. Next, I'm going to show you how to manually send a patient intake form. So if you only need to send a one-off form to a single patient, we'll do that. And this can be done via email or SMS. We'll also touch on a bit on communication templates. This is a way so that you don't have to keep recreating your intake form emails or SMS from scratch, and that makes sure that your messages are always personalized to each patient. Next, the last thing is to how we're gonna automate your patient intake forms. So there are different ways how you want to automatically send them. We can do this through online bookings or campaigns. So you'll never forget to send them out. All you need to do is set it up once and Halaxy takes care of the rest. So these are the topics we're gonna be covering today. It's a very rich topic, so these are the main points to cover. We may touch on some adjacent features, but in the interest of time, we're just going to make sure that we'll drop links to our complete guides in our help guide to those topics in the chat to supplement this webinar. We have a lot, like Halaxy has heaps more features and functions. And if you want to learn everything there is to know about Halaxy, please visit our help guide at support.halaxy.com. We have hundreds of support articles and we even have tutorial videos there, all to help you, to guide you how to use every feature in Halaxy. We also have an in-app resource, the help and resources button. You'll find it in Halaxy in the bottom left. This is plugged into our help guide as well. So just straight from Halaxy, you can search directly in here. So if you typed in this search bar here, intake form, it'll pull up all the articles on intake forms from our help guide. We have links to our recordings, our webinar recordings as well. And we also have a news tab, so you can always check out like the latest updates from Halaxy. If you want to follow along, please log into your Halaxy account if you have one, or if you don't have one yet, you can create an account. It's free. You don't need to add your credit card details. You don't have no lock-in contracts or anything. Yeah, and we recommend opening Halaxy in a separate browser window and put it side by side with the webinar so you can see both screens at the same time. If you want to participate in this webinar, we have the chat function here in the webinar. Just click on the chat tab and you can drop in your questions at any time during the webinar. We have Sarisha, Ruchi, and Mike joining from the customer service team, and they're available to answer your questions. Just a quick reminder to please keep your questions relevant to the topic, which is intake forms. For any other complex questions, if it's highly like specialized to a specific situation, you might want to email or call the service team instead, so they can assist you better. So that's all we have. So that's what we have for our webinar. So let's get started. So just a quick question for everybody here. What are you currently using for intake forms in your practice? Are you already using Halaxy? Are you using clipboards and paper? Are you emailing your forms? I'd like to know where everyone is at. So emailing PDF documents, Snap forms, Halaxy, great. Email, PDF, okay. There's actually a lot who are not using Halaxy intake forms yet. Okay, made up my own Halaxy. Some people are still using paper. Okay, that's good to know. So traditionally, patient intake forms, they collect, this is what practices use to collect patient information. So there's personal details, emergency contacts, claim details, medical history, so just standard sections. And traditionally, intake forms are printed out on paper. Sometimes you give put this on a clipboard and you give it to the patient when they come in for their appointment, and they complete it in the waiting room on the day of their appointment. Some practices may email a document, like as people said here. Some of you said you email a PDF or a Word document. You attach it in an email, then you send it to the patient downloads that form, and then they send it back. So with Halaxy, the way it's done is intake forms are completely integrated with our system and can be sent to patients well before their appointment date, so that when a patient completes their form, their patient profile on Halaxy is instantly updated. So there are great benefits here. It keeps your practice efficient. You save time on emails and data entry. You're not handling multiple digital files. You're reducing manual errors. And you also remove an otherwise routine task that is admin paperwork. So what can you capture in a Halaxy intake form? So it's pretty much anything you need. So apart from the standard sections, which is personal info, contact details, emergency contacts, you can collect card payment details. So this way, the patient's card payment is in their profile, and you can instantly process payment for their invoice, like after their appointment. So you don't have to keep chasing up payments. You can ask for referral letter uploads, clinical questionnaires that you want them to fill up before their appointment, consent to treatment or terms, medical history, really anything you need. You can even create your own questions and answer options. That way, Halaxy patient intake forms are completely customizable to your needs. So how it works is, from Halaxy, you send the patient intake form via email or SMS. And when the patient receives the message, there's a link that they click. It takes them to the form. They can complete the form on their mobile device. It can be their phone, their laptop. And after they submit the form, their patient profile is updated, and the intake form answers are stored in a clinical note. So you can also use intake forms for different purposes. So it's not just about getting their personal info. So obviously, like, that's the most standard way of using intake forms. So you request the patient information, but this is usually best for initial consultations. You don't necessarily need like their Medicare card details on their like fifth appointment anymore. So for example, subsequent or specialized appointments might need a separate intake form. So for example, it's a pregnancy consultation. You might have a specific intake form with specific questions, or treatment to quit smoking. So you can have a different intake form for that as well. You don't always have to use the same one. And there's also task-based forms. So let's say you only need the patient to update their credit card details. You can also send just the card payment details section, and that's all that's going to be sent. Or if you want them to fill up just the clinical questionnaire, you can also use an intake form just for that. So yeah, that's how Halaxy patient intake forms work. I'm just going to quickly show you what it looks like. So when a patient receives the intake form email, it looks like this. There's a link that they click. And when they click that, it takes them to the form. And as you can see, there are different sections here. So with here, they can add their Medicare details. There's who the referring practitioner is. They can add a file to upload their referral letter. I've attached a DAS-21 questionnaire here. If there are any psychologists, this is pretty common for psychologists to include. There's also a consent form here that they can add their signature. And once that's completed, it instantly updates their patient profile. So that's how it works. Does anybody have any questions? Um, by the way, just Miruna, there's no cost to using intake forms. There is a cost though if you're going to be sending it via SMS. It's free if you send this via email, but if you're sending via SMS, you need to, it's 1 credit for per SMS. You need to pay Halaxy in Halaxy credits for that. Our own consent forms into this, okay. Yeah, Katie, you will need to add the patient to your Halaxy first, and then you can send them the intake form after. It doesn't need to be a complete profile yet. Yes, you can use intake forms for anybody. Can you also add consent note templates? Okay. Some of these questions are going to be answered in just a bit. So we'll get into that. So our next section is we're going to set up our intake form. So if everybody's ready, so I'll jump into Halaxy. So to set up the intake form, if you look on the side panel, click Settings, and then click General. And then if you scroll down to the bottom, under the clinical settings section, there it says here patient intake form. So just click the pencil icon here. And when you sign up to Halaxy, you already have a patient intake form here. That's a standard that Halaxy provides. So you can set up this form. You can just click it to open it, or you can add your own form. So you can click Add Form here in the top right. And this takes us to the template editor. So this is where we're going to add in our content and set it up and how to set up our patient intake form. So let's give it a name. So the example we're going to have today is a patient intake form for new patients. So let's just label it like that. Description here is just for your internal staff. This isn't visible to the patients you're sending this to. So, so you can say for initial consults only. And then later on, if you're no longer using this intake form, you can set this status to archive. That means it can no longer be used. It can't be selected for sending. So you can do that when you don't need this intake form anymore. If you scroll down, so the next section here, intake template, these are the standard sections in a Halaxy patient profile. So you can add in, you can just tick or untick the sections that you want to include. These will update in the patient's profile. So we'll go through this one by one. So patient details is, it's just the standard patient profile information. So their personal info, emergency contacts, and their contact details. By the way, I just have a quick pro tip for everybody, especially if you're a beginner. And you can use this anywhere on Halaxy. Do you see this little question mark icon next to this field? You can just hover over that. That's a tool tip. So this is all over Halaxy. If you're not sure what a field is asking from you, you just hover over that and it'll give you more information on what this does or what this needs. So here, this is what's included in patient details. Introduction source is if you want to know how your patient discovered your practice. So like if they found it through a friend or Google or whatever, you can tick to include that. You might want, if that's something you want to take note from your patients, you can run reports on this where most of your patients are coming from. Next is card payment details. So this is really important. There are a lot of practices that include this in their intake form, and you can also make this required, meaning they can't submit the form unless they've added this. So this is really handy if you don't want to keep chasing up payments from patients. You can, if they submit their card payment details, you can process their invoice right away. Bank account details is just if they don't have a nominated bank account with Medicare, this is where their rebates are going to be deposited. But if they have a nominated bank account, this it's not really necessary. Patient social history it attaches the social history form. So you can collect family history, a list of medication, economic status, demographic information. This is purely optional. It's a separate form that you can set up on Halaxy. We don't want to get into that. That's another topic on itself. But social history has its own tab on the patient profile for quick reference. But any of those questions can also be added here in the intake form. So you can choose to include it. You don't have to. And next is the claim and funding information. So I'm just going to add that. And so this is where a patient can add their Medicare card details. So you can choose to add whatever funder. So for example, you have NDIS or say WorkSafe, they can add in their claim details there. So for this, I'm just going to click Medicare. And once you've selected that, you've noticed this referral details section also appeared. So I'm going to click that. And I want patients to be able to upload their referral letters. So if you see this column here, this is what allows them to upload a file. So I'm going to allow that for referral details because I want them to upload their referral letters. So these are the standard sections in the Halaxy intake form that also updates in their profile. The next section is the manage templates section. So you can include any clinical templates or clinical tools that you've imported or created. For example, we can add, say, if you've created your own consent form in the clinical templates, you can add that here and you can require their signature. And let's just make that mandatory. So let's tick that here. If you want to know how to create a consent form using the clinical templates feature, Shane is just going to drop a link to that. I would love to show it here, but we have a lot to cover. So we'll give a step-by-step instructions here in that link. So Shane's just dropping that help guide link. You can also add a questionnaire that you've imported. So Halaxy has like hundreds of preset clinical tools and questionnaires, which you can import for free into your practice. So for example, I want the patient to fill up the DAS-21 in this intake form. So I'm just going to attach that here. It's going to appear on a separate page like I showed you earlier. Next, you can also add any files. So if there are certain files you want every patient to receive, like pamphlets or brochures, you can add that here and just attach the file. So if these sections are the only sections that you need, great. You can click the save button here and go straight to sending it. Just make sure to delete this empty section here, which you can do by clicking the X button here. But if you have any other questions you want to add to your form, if there are any custom questions you want to add, I'm gonna show you that now. So this is an additional section. So say, let's call this more information. You can call it whatever you like. And the description, the patient will see this in the form. So let's add a new question. So click this button here, add question. So if we want to add a question, let's first type it. So let's say the question I want to add is, are you currently taking any medication? So we have never had this question before, so we're just going to add it as a new template question. So if let's say there's another intake form and you want to have this question, you want to include this question as well, you can then, once I've added it, I can now reuse it in another question. So I don't have to keep setting up each question from scratch. So for example here, are you currently taking any medication? We're now going to set up how the patient should answer this. So we have to select an answer type. So this can be free text. So for example, free text can be, they actually type it, yes, I'm taking medication. Or you can make it a single choice, which is multiple choice. This can be like yes, no, and they just select it. There are other answer types for different kinds of questions. There's multiple choice, meaning they can, it's one of those select all that apply. There's an annotatable image. So this is handy for, say, body charts. And the question is about like, select all the affected areas. And the patient can then draw on the image. There's numeric value if the patient is required to give an answer in number form. So this can be for height or weight. And then there's also date and time. So we're going to select single choice here. And then there's also, there's a field here called data set. So this template question, if some questions can be reusable, data set is more like reusable answers. So Halaxy has a lot of preset answers. So this can be like a scale of 1 to 10. This can be, say, age group. So you can use any of these preset answers, or you can add your own answer options as well. So let's say I'm just going to add my own, and I'm going to put here yes, and click add answer option again and say no. You can opt to put scoring on this, but I'm not, you don't have to use it. This is purely optional. So now I have this question, right? So are you currently taking any medication? They can only submit one answer, and it's either yes or no. So I'm going to click save. So now I have this question here. Are you currently taking any medication? Now, I want patients, if they answered yes to this question, I want them to list down what medication they're taking. But I don't want that question to appear if they answered no. So we can make this question a conditional question where you can have a follow-up question or multiple follow-up questions only if they answered a certain answer. So if they answered yes here, so next to the question, if you see the split arrow icon, this is to make this into a conditional question. So if you just click that, so let's put the condition here. So if they answered yes to this, then we're going to add a follow-up question. So let's enter the question here. So it can be like, please list your medications. And we're going to add that as a new template question. And because we don't know what medication they're taking, we're just going to configure this question to be a free text type. And let's just use a regular text box. So this means the patient's just going to type out the medication names. And then let's click save. So now we have a question. We've made it a conditional one. So this question will only appear if the patient answered yes here. So you can add more more follow-up questions to this question by clicking the split arrow icon. So you can add more questions by clicking add question. You can add more sections to break up your form. So yeah, that's how you add questions to your intake form. You can have as many as you need. And when you're ready, once your questions are ready, you can click save. So we're just going to click save. Template was successfully updated. So, okay, we have our intake form. We've just finished setting it up. We can start sending these out. If you need our full step-by-step instructions to refer to on how to do this, we have a complete guide on our help guide. So Shane is dropping the link to our article on how to set up our intake forms. So there are different ways to send an intake form. So the first way I'm going to show you is how to manually send it. So let's say you only have to send an intake form one at a time as needed. So we're going to send that from the patient profile. So let's search the patient. So if you click on the sidebar, patients, and then let's go to our patient list. And say this patient, and I think somebody asked earlier, like, do you need to create an account for a patient in order to send them the intake form? The answer is yes. So you can do that from the calendar. You can do it here from the patient list. Sorry, let's just quickly add a patient. So from the patient list, click add patient here in the top right. And I'm just gonna send this to myself. Let's set their contact email to that. So to send this patient an intake form, under contact details, you see this icon here? It's like a form with a pencil. Make sure if you click that, it'll take you to the intake form, send it patient intake form pop-up. So if you need to send an intake form, you need to have the person's either their email address or their mobile number. So you can send it via email or SMS. You can switch between the two here at the top. So let's send this via email. So here under intake form, let's select the intake form template that we created earlier. So that was patient intake form, new patients. Now you can set an expiry date for this form. So this is the date until which the patient has to fill up the form. Once it's past this date, that the link that they receive will no longer be valid. So you can, by default, Halaxy sets this to 14 days. You can set this to 3 days or 1 week if you want. So we can set this to 1 week. Select who the sender is. You can add a subject. So your intake form. And then this, your recipient, it defaults to this. And then in your message, this is where you can say, hi, what was the name? Hi, Bruce. Yeah. Please complete your intake form before your appointment. And then this is really important. If you're sending a patient intake form, you need to add the link. So the way to do that is through dynamic terms. So if you see this dynamic terms drop down here, click that and then search for online form link. So you can search that, click it here, or you can just type it directly, like the brackets, online form link in those brackets. So this is a dynamic term. When you send this email, this dynamic term is going to convert, it's going to populate into the actual link that the patient clicks on to, so it converts into this. Click here to fill our intake form. So that's what this dynamic term is. So once you're done doing that, you can click send, and then your intake form is on its way. So that's a quick way of doing it. One thing, one tip is if you don't want to keep creating that email message from scratch, like, dear Bruce, like doing that, you can also use communication templates. So this is a feature that we've discussed in our previous webinars. So communication template is a reusable template for email or SMS that's you can use to instantly personalize your emails and SMS. And it's just so you don't have to keep recreating the same email from scratch. So for example, here, communication template, I've created one before. And if I click that, if you see, it instantly populates the subject, it populates the message. It's already, it's personalized. The online form link is here and your practice name is here. So communication templates is a whole section. We've discussed this in previous webinars, but we also have step-by-step instructions for this. So if you don't know how to do this, Shane is gonna drop the link to how to create communication templates. It's really easy. So this is a way to, this is one of the other ways that Halaxy speeds up your admin. So you don't have to recreate these emails from scratch. Thank you, Shane. So that's how you manually send an intake form to patients. So this is fine if this is fine for one-off instances or you're managing just a few patients. But what if you are in a large practice or you're an admin managing patients for multiple practitioners? This would not be very efficient. So the good news is sending intake forms is a routine task that Halaxy can handle for you. So this is where automation comes in. And this means you'll never forget to send intake forms to patients again, and you'll get back more time during your day to focus on the important work, which is treating patients. So this is our last section, which is how to automate your intake forms. So there are two ways to do this. One is through online bookings and one is through campaigns. So does anybody here use online bookings yet? Halaxy online bookings? If, okay, yep, people are using online bookings, some are not. If you're not yet using online bookings, that's fine. We're also going to have a specialized webinar on that in a couple of months. But for those who are currently using online bookings, you can automate your intake form so that after a patient completes their online booking, they're automatically sent an intake form. So the way to set that up is, so if you look at the side panel, click settings, and then click general. And if you look at the right, under patient portal, and you see this patient intake form row, click the pencil icon next to it. And this is where we're going to set up our automation. So as of right now, so intake forms are enabled. By the way, you can also require 2FA for intake forms. So when a patient receives the link and they click on the link, they'll receive a verification code in a separate email that they'll use to access their form. So it's just an added layer of security. You can set the intake form expiry time. So this is like 14 days from when you sent it out. And then after that, the intake form link is no longer valid. You can also customize the actual link label. So earlier in the email, you know, where it said, click here to complete our online intake form, and that was the link. You can customize what that says here. So you can say, like, the intake form link or something like that, whatever you want to choose. And here, this is where we automate intake forms for online booking. So for automatic intake forms, click enabled. And here you can select which default intake form template is going to be sent to people who do their bookings online. So for example, here, we can select the patient intake form, new patients, and we can also select that we can also configure that this form will only be sent only on their first booking, or if you want it on every online booking. So let's just set this to only on their first online booking. And the last field here is if you want individual intake form emails. So by default, this is disabled. This means that the patient receives the link to the intake form in the booking confirmation email. But if you want it to be on its separate email, you can click enabled. And this puts the intake form on its separate email. This is good if you really want to get their attention. If you feel like most people will not really see the link in the booking confirmation email, you can put this on its own separate email, and then you can select the communication template. And then when you save that, you've automated it. So every person who books their appointment online, they're going to get that email. They're gonna be sent that intake form email when they complete their online booking. So just looking at those settings again, so this is a default intake form template. This is going to be for regardless of whatever appointment, what service they're booking for online. But let's say you don't want everybody to get the same intake form. So you don't want everybody to be getting this new patient's intake form for, say, like a recall, like a sort of a subsequent consultation. You can make sure that specific services have their own separate intake forms as well. You can automate that. And the way to do that is to assign an intake form to a fee. You can do this on the fees page. So if you on the sidebar, click finances and then click fees. So say this consultation, say this pregnancy consultation. You click it on the list to open it. And then just here in the fee details section, you'll see there's like these online booking settings, right? So here under online booking intake form, by default, it's using the group default, what we set earlier, the one for new patients. You can choose you can choose not to send an intake form if somebody books the specific service, or you can select a different template to send to them and then just click save. So if somebody books that fee online, it's gonna get a separate intake form template. So That's the way to automate your intake forms via online bookings. Now, let's say you're not using online bookings, but you want to send out intake forms automatically to people, say, well before their appointment. We can use campaigns. So campaigns are mass emails that you can send to all your patients or select patients. So to create a campaign, we've discussed this in previous webinars, the first thing you need to do is to create a report to generate your list of patients. That becomes your target audience. And then you set up the campaign to run automatically. So I'll just quickly do that. So the first thing we'll do is to create a report. So let's say for this example of a campaign, we want to send an intake form to patients, to new patients, 7 days before their first appointment at my practice. So let's run a report for that first. So on the sidebar, click reports, and then click appointment. We're going to run an appointment report. So on the upper right, click new report. And we're going to set this report type to attendance. So we're going to look for patients who have their first appointment in 7 days, 7 days from now. So under length, let's set this to equals 7. And then let's say days. So equals 7 days before next booked or confirmed appointment. And because we want to target only the new patients, under appointments, let's say, let's put 1 total appointment. So that means they've only had 1 total appointment, which is the upcoming one. And then we're just gonna run that that report. So some of you may have a list of patients here. Some of you may not have. That's fine. So it's just trying to see if there is somebody to send this this intake form email to. So we'll just save, we're going to save this report and say new patients in 7 days. And let's click save. So this is the report that's going to generate your target list for your campaign. So up here, up top, see this button set as campaign, just click that. So we're going to turn this report into a campaign. So we'll save this campaign as, say, intake forms for new patients. Scheduled date and time will be when do you want to start sending this this campaign. So let's say today, and say at 3 p.m. we'll start sending it. And then we'll select the email template that we this is the communication template that we that you've created. And don't worry, Shane, I think Shane has sent the link to that. And then select which intake form template you want to send them. And then send on behalf of, so you can select which practitioner is sending that. If you want to send the intake form to the patient's contacts, like their parents or their guardians, you can click, you can tick this box here. And we want this campaign to repeat. We want to repeat this every day because we want Halaxy to constantly check every day if there are patients coming up, new patients coming up with an appointment in 7 days. So let's repeat that. And we want to repeat that every day. So we don't want this campaign to end because we want it to be an ongoing thing. So you can just leave this blank. And then click, when you're ready, click save. So you've saved the campaign. Now your intake form emails are going to be automatically sent to your patients from here on. So think about it. Your intake forms will now always send themselves. When your patients complete their form, their profiles in their patient profiles in Halaxy also update themselves. And this is all without you needing to do anything. So there you have it. That is how you set up and send and automate your intake forms. You can get your patient's info well ahead of their appointment, and you can significantly reduce your admin work. So there's a reason why this is one of Halaxy's popular features. I hope that's all we have for today. I hope you enjoyed this webinar and you found it useful. Make sure to check out our help guide, support.halaxy.com. Everything you need to learn about intake forms is available there. We have tutorial videos on everything that I discussed here. And yeah, we also have monthly release notes where we list out our latest features. So please check out our help guide. And I'd also like to remind everybody to, when you exit this webinar, there's a quick survey. Please, if you could take some time to answer that, we'd really appreciate it. We're always looking for ways to improve our webinars. And yeah, that's it for me. And I'll be handing you back to Shane now.
Amazing. Thank you, Ria. That was a really awesome webinar. Really appreciate you sharing those insights with us. Okay, so I know we've had a lot of questions throughout today's session, but we do have a bit more time for a Q&A. So Ria and our team of experts from Halaxy will be answering any questions you have. As you've done throughout today's webinar, just leave them in the chat and we're going to get through them. So just have a couple of minutes to drop those in the chat. If we do have any.
Hi, Karen. When the info comes in, so if somebody updated their like contact details, it's just for one, the patient profile is just instantly updated. It's populated with the answers. And second, it's gonna be on in the clinical notes. So if you open the patient's clinical notes, all their answers from the intake form are gonna be listed there as a new note, which you can open anytime. Why can we see the mandatory signature on the intake form? Why can't? It's quite lengthy. Any way to see? Hi, Veronica. So yes, they can save if they anytime a patient clicks save and continue on the intake form, it saves what they've added, and then they can click the link again to access the intake form to go back to it. Set up. Will Halaxy send it out if the patient has already completed the form manually? What do you mean by completed the form manually, Anna? Um, uh, sorry, can you set up multiple dynamic terms for different intake form types? You can use different dynamic terms in the intake form email. You can use different ones. You can use your practitioner name. The one thing, one thing to note though, you can't use the dynamic terms that have some that are relevant to a specific appointment. To be able to use a dynamic term that uses appointment details, the record has to be attached to an appointment. So for example, you can use that for a clinical note because a clinical note is linked to an appointment. So that's why you can use those dynamic terms. But the intake form, when you send it out from the patient profile, it's not attached to an appointment. So just be wary of that. Mother. Hi, Scott. So we get this question a lot about patients with parents who need to fill it up, and let's say the parents are separated. So what sometimes we recommend to practitioners is to have two different intake forms. You send one to the mother and you send the other one to, say, the father. And you can have different questions for both, but say any standard information, like say the contact info or payment details, they're going to be sharing that information because it's all linked to the child's profile. So you can opt to do that instead. Customized questions the customized questions will appear in the clinical notes. So when a patient completes an intake form, it's going to create a new clinical note in their patient profile. You can always refer to it there. Ashley, sorry, forgot to mention. Alternate form. Dominica, you need to include the dynamic term online form link because that's what converts into the actual link that the patient has to click on to access the form. If you don't have this dynamic term, there's nothing for the patient to click on to access the form. Yeah, Nikki, dynamic terms are included in the template, in a template, but it has to be something that's not related to a specific, it can't be like appointment time or say the referral practitioner, because it's not linked. You can use like the patient name, your practitioner name, the practice location. Sorry, I don't want completed the form, have to do it again. Yeah, they don't have to. If let's say you're automatically sending these intake forms, that's why in earlier in the online booking settings, you can say you can configure that only send the form on the like on their first booking. So just going back to the general settings here, if you open the settings, so you see here the intake form template, you can send form only on their first online booking. So if you don't want the patient to keep receiving it, you can select this. Whoop, whoop. Very nice. Hi, Anna. Yes, if they don't use online bookings, you can use the campaigns feature instead, which we discussed. Yeah. So if there's data previously collected on a form, so for example, you send an intake form to a patient, and then in a like few months, you send the same intake form to a patient. Any of the standard sections from Halaxy, say emergency contacts, if that's already been completed, it'll come up already completed on the patient's side. So they don't have to, it's not going to be completely empty. So for example, they've already sent in their Medicare card details. When they open the form, their Medicare card details are already populated. If they want to update that, they can, but they don't have to do everything from scratch. What else? Yeah. For other questions, if you have any other questions, please send them to community@halaxy.com. We are running out of time, and I'm just going to hand you back to Shane. Thank you so much, everybody, for your questions. Thank you for joining us. Please also be reminded that we have recorded this session, and you can access it anytime. Everybody who registered will be emailed a link to this recorded webinar. So I'll hand you back to Shane now.
Thank you, Ria. More great insights, so really appreciate that. And thank you everyone for asking the questions. It's really great to see this level of engagement at our webinars. So I guess the question is, what's next? If you enjoyed this webinar, we do have a full series of Halaxy onboarding webinar recordings that you can explore at your own pace on Halaxy. You know, our onboarding webinars include everything that can take you through what you need to know to make the most of Halaxy, starting with our Getting Started webinar, which covers everything you need to know to launch and run your practice in Halaxy. Then we move on to our Streamline Your Scheduling webinar, which is all about unlocking the magic of Halaxy's one-click workflow and discovering how you can run your entire practice right from Halaxy's smart calendar. Moving on to our Manage Your Patient Profiles and Clinical Records webinar, which looks at how you can manage patient profiles, how to set up referrals, rebates, and payments, and how to create and send patient intake forms, and a whole lot more. This is all things clinical. and our Automate Your Practice webinar, which looks at how Halaxy helps you automate routine tasks and eliminate manual data entry, saving you up to an hour every day. This is one of our most popular webinars, and I would definitely recommend you check it out if you've enjoyed today's session. Ria is just dropping the link to that page right now. But going forward, in 2024, we'll be holding a new webinar every second month in 2024. And the next webinar that we'll be looking at is a rerun of our Getting Started webinar. And we're looking to hold that on the 2nd of September. We'll be sending out invitations to that webinar in the next week or so. So just keep an eye out in your inbox and we'll keep you updated. Again, thank you for joining today's session. As Ria said, if you could leave any feedback after today's webinar, that would be most appreciated. It helps us make these live learning experiences better for everyone, and it's really helped us refine what we've done to date. So thank you, everyone, and enjoy the rest of your day, and thank you for your time today.
Thanks, everyone.